There is a sign that appears in the body of almost every man over the age of 50. A silent, discreet sign that most people ignore because it seems normal. You wake up tired even though you haven't done anything too strenuous. Your body takes time to get going. That energy you had decades ago has simply vanished, and no one can really explain why. Your tests come back normal. The doctor says it's just age, but there's something no one is telling you, and today you're going to understand what it is. I'm Dr. Beatriz Tavares, and I'm going to explain this to you with the clarity you deserve. Because what's happening to you isn't weakness, it isn't laziness, and it definitely isn't just age. It's chemistry. It's the pH of your blood. And when you understand what's happening inside your body right now, you'll see why an ingredient that costs pennies and is already in your kitchen can completely change the way you feel. But there's a critical detail in this story, one that most people get wrong. And if you mess up this detail, it can turn something beneficial into something harmful. So stay with me until the end because what I'm going to show you has a specific order that must be respected. Let's start with the real problem. Your body functions within a very precise range of acidity. Think of it this way. Imagine your blood is like the water in a swimming pool. If you don't control the chemical balance of that water, it starts to get cloudy, bacteria begin to form, and the pool walls start to wear out. The same thing happens in your body. There's a scale called pH that measures this balance. The ideal value for the human body to function at full capacity is around 7.4, slightly alkaline. This number may seem abstract, but what it represents is very concrete. It's the difference between a body that works like a well-calibrated engine and a body that drags along, doesn't respond, and ages faster than it should. And here's where the problem that almost no one talks about begins. After the age of 50, and especially after 60, the pH in a man's body starts to drop silently and progressively. With this imbalance, a series of processes inside you begin to fail in a chain reaction. Not dramatically, not all at once, but slowly, almost imperceptibly, like someone tightening a screw 1 millimeter per day. You don't notice the tightening, but one day you look in the mirror and no longer recognize your own energy levels. But what causes this drop in pH? And why is it so common in men over 50? That's what most people don't know. And I need to explain it to you before talking about the solution because without understanding the cause, you'll just be treating the symptoms without fixing the root issue. The cause is a combination of three factors that almost every Western man faces in middle age: a diet that acidifies the body, the natural decline in hormones that once helped maintain this balance, and the oxidative stress accumulated over decades. These three factors together push the pH of your blood downward, and when it drops, something very specific happens that directly affects everything you feel in your daily life. Your body stops producing a substance called nitric oxide in the amounts it should. I know it sounds like a technical lab term, but remember this name because it's fundamental to what I'm going to show you. Nitric oxide is a molecule produced by the inner lining of your blood vessels. It acts as a signal that tells those vessels, relax, open up, and let the blood flow. When you have enough nitric oxide, your circulation works like a highway. Blood reaches where it needs to go, in the right amount, at the right time, delivering energy to your cells, aiding muscle recovery, providing mental clarity, and, yes, vitality in every area of a man's life. But when the pH drops and the internal environment becomes acidic, nitric oxide production plummets. Then the blood vessels behave like hoses being squeezed by a hand. The flow diminishes. You feel this as fatigue, sluggishness, that sensation that your engine is failing. And what makes this even worse is that this process is invisible in routine exams. The doctor looks at your blood count, glucose, cholesterol, and says everything is fine. But what he's not measuring is the tissue pH, or the acid-base balance of your cells. And that's exactly where the problem lies. Now you're probably wondering, is there a way to reverse this? And yes, it's simpler than you might think. But before I get to the solution, I need to show you something that will help you understand why the solution works the way it does. Because what I'm going to present isn't a trick, isn't a miracle, isn't a sales pitch. It's chemistry applied to the real functioning of the human body. And once you understand the logic behind it, you'll know exactly what you're doing and why. Think about this mental experiment. You take a cup of coffee, which is acidic, and add a pinch of an alkaline powder. The powder neutralizes the acidity and the balance changes. That's exactly what happens, in general terms, inside your body when you introduce an alkalizing agent. The powder I'm describing is one you already know. It's in your kitchen right now. It's been used for decades to bake bread, clean surfaces, and whiten teeth. And recent science is confirming that, when used correctly and in the right dose, it has a significant effect on the acid-base balance of the human body. I'm talking about sodium bicarbonate, and I know what you're thinking. That stuff my grandmother used to make cakes. Exactly that one. And I understand the surprise. We've been conditioned to think that real health solutions only come in fancy boxes with complicated names and absurd prices. But what clinical research is showing more and more clearly is that this cheap white powder, when used with precision, has a measurable effect on blood pH, vasodilation, and nitric oxide production. But before I give you the protocol, I need to tell you about the mistake most people make. Because some people read something about baking soda, go ahead and dissolve a full spoon in a bottle of water and drink it all at once. And then exactly the opposite of what should happen occurs. Let me explain why this is dangerous and what happens when the dose is wrong. Because this detail changes everything. First, excess bicarbonate reduces the acidity of the stomach too much. And that's a serious problem. Your stomach needs acidity to function. It's the acidic environment in the stomach that activates digestive enzymes, destroys pathogens that enter through the mouth, and ensures the proper absorption of essential minerals like zinc and magnesium. If you add too much bicarbonate, you throw the stomach out of balance. The result is nausea, discomfort, absorption problems, and over time, increasingly compromised digestion. Second critical point, bicarbonate contains sodium. And this is where men with high blood pressure or kidney problems need to be extra cautious. Excess sodium retains fluid, pressures the blood vessels, and overloads the kidneys. That's why, before anything else, if you have a history of hypertension or kidney issues, you need to talk to your doctor before starting this protocol. This isn't just a disclaimer, it's real clinical advice. Bicarbonate is safe when used within the correct limits. Outside of them, it can cause electrolyte imbalance. Third point, timing matters more than most people imagine. And I'll explain the details on that in a moment, because that's where most of the protocol's effectiveness lies. But before that, tell me something in the comments below. Where are you watching this video from? And have you already felt any of the signs I described? That persistent fatigue, that unexplained lack of energy. Comment here because I read every comment, and it helps me understand what people are really going through, not what lab studies show, but real-life experiences. I'm going to give you exactly what works with the right timings, the right doses, and the combinations that enhance the effects. And I'll tell you what you definitely shouldn't combine, because there's a specific combination error that completely cancels out the benefits. And a lot of people make it thinking they're being even healthier. The first dose of the day should be taken early in the morning on a completely empty stomach. And when I say completely empty, I mean at least 8 hours without anything, which is the natural period of sleep. The dose is 1 to 4 teaspoons. Not a full spoon, not half, but 1 to 4. Dissolve it in a glass of warm water, stir well until it completely disappears, and drink it slowly. Wait 30 minutes before eating anything. This interval is essential because it's the time the bicarbonate takes to be absorbed and start acting on the acid-base balance before the digestive process kicks in with breakfast. Now, here's the mistake a lot of people make, and I need you to pay attention to this. Many people read about bicarbonate and think, I'll mix it with lemon to improve the flavor. Don't do that. Lemon is acidic. When you mix an acid with an alkaline substance, they neutralize each other. You'll produce a lot of bubbles, you'll think you're doing something sophisticated, but you'll basically be drinking water with salt. The benefit disappears completely. The bicarbonate needs to reach your system without being neutralized beforehand. The second dose happens at night, 2 hours after dinner, same amount, 1 to 4 teaspoons, same preparation, in a glass of warm water. And this nighttime dose has a specific function that goes beyond just maintaining alkaline pH during rest. At night while you sleep, your body enters an intense cycle of cellular regeneration. It's during deep sleep that anabolic hormones are released, muscle tissue is repaired, and cellular cleansing processes occur. In an acidic environment, these processes are compromised. In a slightly alkaline environment, they work much more efficiently. For many men, the nighttime dose of bicarbonate is the one that generates the most impact, precisely because it optimizes this recovery cycle that happens while you sleep. And it's not just about pH. There's another effect I want to explain to you. When the pH starts to normalize, the blood vessels respond, they relax, open up, and blood flow improves. And when the flow improves, nitric oxide production begins to recover. It's also a virtuous cycle. A more balanced pH generates better vasodilation. Better vasodilation generates more nitric oxide. More nitric oxide sustains vasodilation and keeps the pH more stable. Once you enter this cycle, your body starts working with you, not against you. I followed a patient, let's call him Hightor, 66 years old, who came to my office convinced that what he was feeling was inevitable. He said it was age, that his father had been the same way, that it was genetic. We measured his pH in the first consultation. 6.5, well below ideal. He started the bicarbonate protocol, 1 to 4 teaspoons per day, morning and night, with the proper precautions because he had slightly elevated blood pressure. After 3 weeks, he called me, not messaged, but called because he wanted to tell me that he had woken up at 6 a.m. with an energy he hadn't felt in at least 10 years, that he was sleeping better, that he had more motivation for the activities he had gradually abandoned in recent years. What changed for Hightor wasn't a miracle. It was chemistry, it was pH, it was nitric oxide. Now, there's something important I need to tell you. Bicarbonate by itself has an effect, but its effect is significantly amplified when you understand what's sabotaging the pH at the same time. Because what's the point of taking bicarbonate in the morning and at night if during the day you're eating exactly the foods that push the pH back toward acidity? It's like trying to fill a bucket with a hole in the bottom. You fill it a little, it empties. You fill it again, it empties. The protocol needs to be accompanied by some changes that aren't drastic but make a real difference. Refined sugar is the biggest acidifier in the modern diet, and I'm not just talking about the sugar you put in your coffee. I'm talking about everything that turns into glucose quickly in the blood. White bread, refined flour, soda, boxed juice, processed cookies. These foods generate an internal acidity spike that no dose of bicarbonate can compensate for alone. If you can reduce these items, even if you don't eliminate them completely, the bicarbonate will have much more room to work. Excess alcohol also acidifies, and excess salt overloads the kidneys, which are the organs responsible for naturally regulating the acid-base balance. So when you overload the kidneys with excess sodium, you're compromising exactly the system that should help keep the pH stable. On the other hand, there are powerful ally foods. Dark leafy greens, spinach, kale, arugula, broccoli. They're naturally alkaline and create a favorable internal environment. Avocado is one of the few foods that combines healthy fat, abundant potassium, and an alkalizing effect. And potassium is essential here because bicarbonate contains sodium, and sodium needs to be balanced by potassium for the body's electrolyte balance to remain stable. Bananas, avocados, and beans are practical sources of potassium that you can include without having to radically change your diet. Water also plays a critical role. Bicarbonate works better in a well-hydrated body. Water is the vehicle that distributes electrolytes, facilitates the excretion of acidic products, and maintains the blood volume necessary for circulation to function. 8 glasses per day is the minimum. And if you exercise, which is another natural booster of nitric oxide production, hydration needs to be proportional. Speaking of exercise, moderate walks of 20 to 40 minutes per day have a measurable effect on vasodilation and nitric oxide production. And this effect is synergistic with bicarbonate. When you combine the pH balance by bicarbonate with the circulatory stimulation from walking, the results are consistently greater than either one alone. There's another use for bicarbonate that most people don't know about: the immersion bath. Bicarbonate in adequate concentration in bath water is absorbed through the skin, which is the body's largest organ. Fill the bathtub with warm water, add a full cup of bicarbonate, dissolve it well, and soak for 20 minutes 3 times a week. Several patients who added this practice reported muscle lightness, reduced tension, and better sleep. One patient, let's call him Renato, 70 years old, used this combination for 6 weeks. In addition to recovering his energy, he felt a reduction in bladder discomfort. He woke up fewer times at night. The urgency to go to the bathroom had decreased. It's no coincidence. The alkaline environment is less favorable for bacterial proliferation in the urinary tract, and the relaxing effect on the bladder muscle can help reduce the spasms that cause urgency and frequency. The acid-base balance has a systemic effect, and the urinary tract is part of that system. And here I need to pause to talk about something important. If you're over 60 and experiencing any of these signs, they deserve medical attention. Bicarbonate can be a valuable support within a well-structured protocol, but it doesn't replace clinical evaluation, exams, or follow-up with a professional who knows you. That's why I want to recommend something that brings together, in a practical and organized way, the main information on men's health care after 60. The medical guide to avoid the mistakes that damage the prostate. It's available in the pinned comment right below this video. It was developed for men who want to understand what's happening in their own bodies, who want to make more informed decisions, and who need clear guidance on what to do and what to avoid at this stage of life. If you've made it this far watching this video, it's because you're that kind of man. It's worth checking it out. Now, going back to the protocol, I want to give you what I call a realistic timeline, because one of the main causes of quitting is the wrong expectation. People expect something to work in 24 hours, and when they don't feel anything on the first day, they conclude it doesn't work and stop. On the first day, you probably won't feel anything dramatic, maybe a slight feeling of digestive lightness. But internally, the pH is starting to adjust. By the third day, many men report a difference in waking up, not a surge of energy, but the absence of that morning heaviness. They wake up without that feeling that the body doesn't want to get out of bed. In the first full week, most start to notice a difference in energy consistency throughout the day. That brutal drop after lunch begins to fade. In the second week, the effects consolidate. Deeper sleep, more willingness for physical activities, less muscle tension. In the first month, patients who follow the complete protocol describe a state they themselves have trouble naming. They say they're feeling better, and when asked to detail it, they point to concrete things. Sleeping more consecutive hours, having energy for activities they had abandoned, being more present in their own lives. There are two allies that greatly enhance the protocol, and I want to mention them quickly. The first is magnesium. It's deficient in a good portion of men over 50 and works in direct synergy with bicarbonate. Pumpkin seeds, almonds, spinach, and dark chocolate above 70% are accessible sources. If you want to supplement, magnesium glycinate is one of the best absorbed forms. But before supplementing, talk to your doctor. The second is turmeric. It has a compound called curcumin with well-documented anti-inflammatory action that acts exactly on low-grade chronic inflammation, which contributes to internal acidification. A teaspoon of turmeric with a pinch of black pepper in a glass of warm milk taken at night before bed combines very well with the nighttime dose of bicarbonate. There's a simple way to monitor your progress at home. In pharmacies, you can find urinary pH strips. Urinate on the strip right when you wake up before drinking anything. The ideal is for the result to be between 6.5 and 7.5. Below 6, the pH is still too acidic and you can slightly adjust the dose. Above 8, reduce it. This gives you concrete data, not just subjective perception. And I get this question a lot. How long do I need to follow the protocol? The honest answer is it depends. Imbalances that took years to install don't get corrected in 2 weeks. The protocol makes more sense as a long-term practice. Many patients describe that after 3 months, it became as natural as brushing their teeth. Missing a dose here or there doesn't undo the progress. What matters is consistency, not perfection. Let me summarize the complete protocol clearly, because I want you to leave here with a real plan in mind. Upon waking with a completely empty stomach, 1/4 teaspoon of sodium bicarbonate dissolved in a glass of warm water. Wait 30 minutes before breakfast. Throughout the day, minimum 8 glasses of water. Diet with plenty of green vegetables, avocado, nuts, seeds. Reduce refined sugar, white flour, processed meats, alcohol. Walk tea 20 to 40 minutes if possible. At night, 2 hours after dinner, another 1 to 4 teaspoons of bicarbonate in a glass of warm water. Before bed, optional but enhancing, magnesium and turmeric. 3 times a week, if possible, immersion bath with 1 cup of bicarbonate in warm water for 20 minutes. Every morning, pH strip to monitor progress. Total daily dose of bicarbonate, 1/4 teaspoon per dose. 2 doses, totaling 1 to 2 teaspoons per day. Do not exceed this. The limit isn't due to excessive conservatism. It exists because, above it, the risks of electrolyte imbalance and compromised gastric acidity become real. I need to be direct with you about something many prefer not to say. The signs we discussed today, the drop in energy, loss of vitality, urinary changes, sleep changes, don't appear out of nowhere. They are the result of years of a body functioning outside ideal conditions. Bicarbonate is a powerful tool within a larger context, but it doesn't undo in days what time built over years. What it does is open a window, create the internal conditions for your body to start working the way it has always been capable of working. And that's the difference between aging with quality and aging by giving in to decline as if it were inevitable. It's not inevitable, not when you understand what's happening, not when you have the right tools, not when you use those tools with consistency and intelligence. You are 60, 65, or 70 years old and still have decades ahead. The question isn't whether you will age, the question is how you will age. With energy, with vitality, with presence, or giving into acidity, fatigue, and inertia. The bicarbonate that's in your kitchen right now is one of the simplest and most underestimated answers to this question. Use it with precision, use it with consistency. Pay attention to how your body responds and don't do this alone without supervision, especially if you have a history of high blood pressure, kidney problems, or take continuous medications. Medical guidance isn't bureaucracy. It's what ensures you'll get the maximum benefit from this safely. If this video brought clarity to something you were feeling but couldn't name, subscribe to the channel. Every week, I publish content about men's health with the same direct language you saw here today. No fluff, no unnecessary jargon, no half-truths because men over 50 deserve quality information, and this channel exists for that. Take good care of yourself because no one else will do it for you.